Between Ontario's capital city and Peel region just to its west, well more than 4 million people are now in the strictest level of lockdown to prevent the spread of COVID-19. Other areas also face tipping points for their healthcare resources. The second wave is taxing people, the economy, and most everything else, even as the first vaccine has been approved for Canada. Here to help us understand what's going on and what's ahead, we welcome, from the downtown core of the capital city, Dr. Eileen De Villa, Medical Officer of Health for the City of Toronto, and in North Toronto, Dr. Lawrence Loh, who's Medical Officer of Health for the region of Peel. And we're really grateful to both of you, too, for joining us. I know how crazy your schedules are these days, so let's get right to it. There have been lockdowns in both of your regions since November 28th. Dr. De Villa, start us off. Can you yet tell whether or not these lockdowns are actually working?
Well, you know, Steve, we're starting to see some changes in the trends. We are seeing some effect. Are we seeing everything we want to see? No, we're not. We know that we're continuing to have high case counts, but we do know that what makes a difference is the degree to which people are able to interact with each other and to have close contact with each other. So to the extent that the restrictions are able to limit that and to remind people of the need to stay home as much as possible and to limit their close contact with those with whom they don't live, then we know that we are having some impact.
How about you, Dr. Loh? What are you seeing?
Yeah, I would agree, Steve. Certainly, we're not seeing everything unfold completely perfectly, but we are seeing things start to level out. And we have to remember, you're not going to see a decrease right away. You've actually got to just stop the thing from growing in the very first place. And so to the extent that the measures have been put in place, to limit the opportunities for in-person interactions, to limit discretionary excursions outside of one's household, I think we're starting to see the effects.
Dr. De Villa, is there enough enforcement going on out there to make you think this could work?
Well, you know, it's interesting. There's always a lot of conversation around enforcement and the value of enforcement. But I think throughout the course of the entire pandemic, what we're seeing is most valuable are actually the choices that each and every one of us makes for ourselves and for our families. There will never be enough of enforcement in any jurisdiction to manage all the behaviors that happen in any given city or region, in the case of my colleagues at Peel. What it comes down to are the choices that each and every one of us makes. And we can choose to do the best we can to protect our health, the health of our families and those around us that we love and care for, or we can choose alternatively. We've seen the ability of people to choose correctly, to reduce their interactions. We've been successful before in reducing the spread of COVID-19, and we're counting on the people of Toronto, and I would dare say in the case of Dr. Loh, on the people of Peel, to do the right thing to help us bring these case counts down and to restore, the kinds of, bring us back to the activities that we also cherish in our communities, get back to life a little bit more like we're used to.
I hear you on that, but let me do a follow-up in this regard. It wouldn't presumably take too many high-profile enforcement situations for more people to get the word. Just as in the case of that fella named Skelly, who was opening up his store and selling stuff that he shouldn't have been, and then had tens of thousands of dollars worth of fines to have to deal with, and the locks changed on his business. What about a few high-profile cases like that, just so that your words would carry more weight? Are you for that?
Well, I think what I am for is for the appropriate application of enforcement. And of course, each enforcement situation warrants its own assessment, and one has to make the determination as to what makes sense in that circumstance. So certainly that's what we've seen. When I've seen the work of our Toronto Public Health enforcement people, or whether it's my colleagues in bylaw enforcement here at the city or Toronto Police for that matter, I have counted on them and have been able to rely on them to make appropriate determinations as to what they see and, make decisions around what is the best approach to bring about the outcomes that we're all seeking, which fundamentally is a safe and healthy community.
Dr. Loh, I'm going to get you to react to this piece written in the National Post just the other day by Chris Selly, who wrote the following. Much as many Canadian experts and commentators argue for the sorts of lockdown measures that Europeans and Australians have endured, The fact is they are inconceivable here. Police ID checks, roadblocks, warrantless searches, mass arrests. In the case of Melbourne, literally confining thousands of people to their apartments for 2 weeks, 24 hours a day. Indeed, most of the people arguing for the Australian approach in the abstract would be appalled if many of its specific provisions manifested here. Do you agree with that, Dr. Loh?
Yeah, I think it's really interesting, and I would actually be also keen to hear what Dr. De Villa has to say about this, because I think the term we use in general is that we are threading a needle, and ultimately there are significant impacts and issues that arise if COVID-19 is allowed to spread unfettered in our community. But we also know that if we go, too hard on the restrictions, that there will also be impacts to health, and ultimately, to the extent that we are trying to figure out the appropriate balance that allows us to get COVID-19 under control, but also addresses some of the other impacts to individuals' health and well-being, it's really important to look at any proposed measures to control the disease in all of those comprehensive lights.
Dr. De Villa, the Australian approach here, what do you think?
Well, I think Dr. Loh he put it quite nicely. It is about balance. And when it comes to public health, when we are thinking about any kinds of restrictions that we're placing on people's liberties, it's always a question of proportionality. We try to do only that which is needed to actually achieve the appropriate health outcomes, the healthy and safe community that we all want to live in. So to the extent that we can do that in a more balanced and a less intrusive way, that's always a better way from a public health perspective.
I don't know what you two are seeing in your email inboxes or the phone calls that you get, but I can tell you certainly on my end, what business would consider inconsistent approach to handling small businesses versus big box stores has really grinded a lot of people's gears, if I can put it that way. In particular for the small business folks who really make half their annual revenues in the month leading up to Christmas. They want me to ask this question. Do you two really have enough evidence to suggest that a significant portion of transmission is coming from people shopping in local stores? Because the impression I'm certainly getting is that when tons of people are crowding into these big box stores, they cannot be safer than smaller numbers of people shopping in smaller businesses. Okay, Dr. Loh, you first. Go for that one, please.
Absolutely. And, listen, my heart absolutely goes out to small business owners. This is like any other natural disaster, really something that is ultimately impacting all of us, and particularly in a very negative way. I liken it, though, to just the fact that our situation has changed. It's not about where it's coming from or sources of spread at this point in time. In the region of Peel, we have significant and unsustainably high rates of community transmission. And ultimately, cases become hospitalizations. And regrettably, some of those that end up being hospitalized end up succumbing to this disease. And the more you have and feed into that cascade, the more you're going to see on the other end in terms of overstrained hospitals, capacity, et cetera. So to the capacity challenges, et cetera. So to the extent that we are trying to limit venues for in-person interactions and really sticking to just the essentials, that's why there is what is a seeming disparity, but just really trying to say, you know what, if there's no place to go, it's more likely that people are going to stay home and do the right thing to limit their in-person contacts.
And I get that position. And Dr. De Villa, I know it's not your responsibility to make sure that the economy is humming. Your responsibility is public health. I do get that. But do you also appreciate the point of view of many citizens who've been in touch with me who say, this just doesn't make common sense. We can crowd into big box stores. We can't crowd, we wouldn't want to crowd. We can't do smaller numbers, properly, protocoled, if I can use that word, in smaller businesses. How does that make sense?
Well, I think what this boils down to, Steve, is this issue of the fact that it's not economy or public health. The reality is that we cannot have a strong and vibrant economy, and we don't have a strong and vibrant community without public health. So as Dr. Loh rightfully points out, the point behind the policy now, what we are seeking to achieve through the policy levers that have been, deployed, is to actually reduce the likelihood that people are out and about and inadvertently mixing with each other or mixing with people who may have a COVID-19 infection. So to the extent that people are restricting their actions as much as possible, staying at home as much as possible, limiting their close contacts with those to whom, with their household, with the people with whom they live, that's the best way we can actually bring COVID-19 under better control, limit the impacts on our hospital system and our healthcare system writ large, and restore balance in our economy and in our communities writ large.
I do get that, but again, I am going to go at this again because help me understand why it makes sense for people to be able to go shop at Costco, for example, or Walmart, and spend as much time there as they want, with as many people in those stores as they want, but smaller stores have to close, even if they restrict, say, to 5 customers at a time. How does that make sense?
Well, I think that might be a question that's better addressed to our provincial counterparts. But I would say this. I think the issue is around, access to essential products and, the things like groceries and pharmaceutical products. These are the kinds of things that we recognize are essentials and that people need to have access to. But at the end of the day, what we are seeking to do here through public health measures is to reduce those interactions, to reduce the likelihood of ongoing transmission of COVID-19 by reducing the opportunities that people have to mix with those who are outside of their household.
No, I do get that, and you're quite right. Ultimately, it was a Government of Ontario decision that put this in place. So, however, it sounds like you agree with it. So, anyways, moving on. I've tried that one enough. Dr. Loh, let's go to you on this one. There has been a great deal of talk in Brampton over the last several weeks. Brampton, of course, being a part of Peel Region, particularly during Diwali, when many people were getting together in large numbers at private gatherings, either before or after religious services, turning these gatherings into potential super spreader events. Can you confirm for us here that, in fact, a lot of transmission did take place in that fashion?
Absolutely. I mean, the reality is that Diwali aside, with every holiday, with every large celebration, we've actually seen cases where people are still congregating, still getting together, and resulting in transmission events. And that, if anything, actually gives us a little bit of pause with the upcoming holiday season. We have to remember that this is not a normal holiday season here in December, and we do need to continue to make sure that we are limiting our close contact as much as possible to the people we already live with under one roof, and outside of that to just make sure that we're only meeting in person for essential reasons. Because the reality is that with Diwali, but also with Thanksgiving, with Halloween, we did see in the region of Peel significant transmission. And in fact, it was the post-Thanksgiving surge that ultimately pushed us deep into our second wave.
Dr. De Villa, can you help us understand now that we started off this by saying that it was at the beginning of the program, it's only a few months ago we were having 100 cases a day across the whole province of Ontario. Now we're up close to 2,000 cases a day, or positive tests a day, I should say. 2,000 positive tests a day in the province of Ontario. I get Diwali in Peel Region, I get restaurants, I get big box stores. Where are you seeing the biggest numbers of transmission, Dr. De Villa, coming from right now?
So I think, as has been the case throughout the entire pandemic, what we are seeing is the major source of infection is close contact with other people. That's the primary mode of spread of COVID-19. And as you've heard, it is extremely unusual and frankly, very, very difficult for us as social creatures to not want to congregate, especially on special occasions and celebrations. It is very natural for us, particularly under times of duress and stress, to want to be with each other. Unfortunately, that is exactly what promotes the spread of COVID-19. And so we have to fight our instincts and break with, time-honored and really important traditions that many of us hold dear if we are to be successful in terms of combating the spread of COVID-19. That's one of the very challenging aspects of this particular pandemic.
Well, okay, let's get into this now because, of course, we are in the holiday season coming up. There are people going to be celebrating Hanukkah. There are people going to be celebrating Christmas. We've got Kwanzaa coming later in the month. Ismaili Muslims are going to be celebrating the birth of His Highness. Lots of different reasons for lots of different religious groups to get together right now. And okay, Dr. Loh, give us your best advice on what's okay and what's not okay as the month continues.
Absolutely, Steve. I mean, I think in the region of Peel, especially with our continuing rates of community transmission, the advice is starting to look the same. It's essentially at this time, hosting social gatherings or attending social gatherings is a high risk activity for spreading COVID-19. And so I think people should be anticipating that, as with every other holiday that we've seen since the start of the pandemic in our community, it's going to have to look a little different this year. Really focus on limiting the close contact and celebrating with those that you already live with under the same roof, and then connecting virtually with others, definitely. I think that's just the way it's going to have to be.
Dr. De Villa, I heard him say limiting. Does that mean absolutely verboten anybody who doesn't live in your home shouldn't come over to your home?
Well, there are some exceptions, and there's one in particular that I think is worthy of note. For those who live alone, we're asking that, in order that they have some togetherness and have that ability to connect with others, which we know is important from a health perspective as well, that they choose one other household to connect with. We don't want people to be alone over the holiday season. We know how difficult that is. The nights are long, the weather is cold. We don't want to worsen mental health conditions or leave people in a socially vulnerable situation. So those who live alone can connect with one other household. But other than that, as Dr. Loh says, stay home as much as possible. Keep your social interactions restricted to those with whom you live. Connect with others virtually, remotely, phone, FaceTime, whichever your preferred method might be. And hopefully by next year, we will be able to have holidays more like we're used to, and ideally everyday lives a little bit more like what we've been used to in the past.
Well, you two are not going to be surprised that I'm going to want to drill down a little deeper on this as we go along here. Dr. Loh, what about, because I'm going to, if that's one exception, I'm going to see if there are some other exceptions out there as well. Dr. Loh, what about the notion that family A stays in its bubble, has followed all the protocols that you want, they're excellent at mask wearing adherence, they are physically distancing, they are washing their hands. That's house number one. House number two does the very same thing. Any issue with the two of them getting together, physically distancing, wearing masks, washing hands for an hour on Christmas Eve? Any issue with that?
Well, again, Steve, ultimately, I think our recommendations are recommendations, and it'll be up to people to decide, how best they can adhere to them, how best they can assess their own risk. And as you describe it, that situation, I mean, sure, it might be low risk, but I know people that have personally been touched by COVID-19. I know people who they followed all the rules, and yet COVID-19 still managed to visit them. That's just how insidious this virus is. So there's never any guarantee of certainty, and the precautions are the precautions, but they are by no means bulletproof.
Dr. De Villa, I'm going to give you yet another example, and this one I think is even harder, and it's heartbreaking. I spoke to somebody today whose father is dying. He's got probably less than half a year to live. And the family understands that this will almost certainly be their last Christmas together. And they are protocol adhering people. And they are asking themselves, they are all asking themselves, both family and parents/grandparents, whether it's okay to get together for a couple of hours on Christmas Eve. Now, they know it's a risk, but given this man's circumstances, how big a risk is it really?
Okay, Steve. Well, I would say this. I think Dr. Loh covered it really well. The recommendations are the recommendations. And, we trust that people have to make their own best decisions. There is no perfect 100% risk-free solution. That just doesn't exist. But I can tell you this, Steve. We had a recent loss within my family, and it was an anticipated loss. And I can tell you that we did follow the rules. We did not convene together in keeping with the rules. As difficult as that was, we found ways, to say our goodbyes, to express our grief, and to be together in that very, very difficult moment, while respecting the COVID-19 protocols. But I recognize that each of us has to make the decisions that make sense for our own unique circumstances. But at the end of the day, the advice still rests in the fact that the safest thing to do is to limit that interaction and to keep close contact limited only with those people with whom we live.
I really don't want to invade your privacy here, so feel free to tell me to get lost. But did you find that in spite of all of the tragedy you were dealing with, it was a satisfactory way to deal with the issue, considering protocol adherence, the need to be with this person, etc.?
Yeah, I don't know that there is ever anything satisfactory around the grieving process, Steve, to be honest with you. But, I felt that I was able, and that we as a family were able to be supportive and supported by each other in that very, very important and delicate time.
Okay, understood. Let's talk vaccines. Dr. Loh, Health Canada gave the Good Housekeeping seal of approval this week. When do you suspect we will start to see people with needles in their arms?
Well, Steve, that's a really great question. And as far as I know, from what we understand, we are being asked to start planning, or at least we've been planning for quite some time, obviously, but we've been asked to start anticipating that this is going to happen in very short order following the Health Canada authorization. And so, I don't know. I think at least in our region, we're anticipating that many of our vulnerable populations, some of the guidance that's being issued by the provincial, in accordance with the guidance issued by the provincial government, maybe in a matter of weeks or months.
Oh, I gather, I've just been sent a note here by Cara Stern, who's producing this, that apparently the Premier of Ontario, as we speak, has said University Health Network Tuesday next week. So it's coming sooner than we thought, the first vaccines. Okay, here's the follow-up question for Dr. De Villa, which is, you got to make sure this is done fairly. And I don't know what the definition of fair is, but you guys do and the politicians do, presumably. What does that look like to you? Fair, equitable distribution of vaccines?
Well, to my mind, it is a question of understanding how best do we roll out the vaccines in a manner that provides for protection, particularly for those who are most vulnerable and most sensitive to the negative outcomes associated with COVID-19. And in fact, what we've seen already is from the National Advisory Committee on Immunization and echoed by the decisions that have been taken thus far at the provincial level, that there are priority groups, thinking in particular of those who are older in our population, especially those that live in congregate settings like long-term care homes, the staff who take care of them, healthcare workers, and adults in Indigenous communities, as I recall, are amongst those priority groups, given what has been provided at the federal level and echoed by provincial advice as well.
And let me just follow up in this regard. Once you get your 2 shots, if that's what it takes, once you get your 2 shots, do you still have to wear a mask and socially distance from other people and wash hands and all that stuff? Dr. De Villa, what's the word on that?
Yes. So in fact, while the vaccine is certainly providing a great deal of hope to many of us, it does not mean an end to those important self-protection measures, right? We still have COVID-19 circulating in our community. And even though we've got, we are soon to be having vaccine as one of the tools that's going to be deployed in the fight against COVID-19. It is not a silver bullet, nor does it happen overnight. So I think we can expect to see the need for ongoing self-protection measures for some time yet.
Okay. Dr. Loh, any chance of you recommending a late return to school in the new year?
Absolutely. I mean, I think it's something that we're all going to be considering in our community context. So there's conversations and discussions, really trying to see where the trend line is going to go in terms of our cases, what our hospital capacity is going to look like, testing as well, which is an important component of responding to cases or outbreaks that are identified in school settings. So all of these are considerations that are being discussed. And as for whether it's being considered, I can say, yes, it is. Certainly, we would want to work with our school board partners and with the Ministry of Education around any such decision that might be taken. And we'll make sure that we make whatever decision is made is certainly in the interests of continuing to protect the health and safety of students and staff and our community.
Okay. Dr. De Villa, I got about a minute left here, and let me put it to you for this. The one thing, besides the small business angle, the other thing that I'm hearing about from our viewers and listeners more than anything else is frankly just how sick and tired they are of this whole thing. They get that they have to follow protocols. They just don't want to. They've had it up to here with COVID-19. They accept that the advice that you and Dr. Loh are giving is accurate, but, they've had it. So my question is, how are you really going to turn the corner on this thing when people have just had it up to here with COVID-19?
Yeah, that's a million-dollar question, Steve, no question. If it makes the public feel any better, we're tired too, right? This is not something that is unique or that public health physicians and public health staff are immune to. We too feel that pain. We're part of the community as well. But what I would encourage people to think about is we know we can do this. We have done it before. We have been successful in terms of reducing COVID-19 spread in the earlier wave of this pandemic. And now we are about to have vaccines join the toolkit of what we have available to us in terms of fending off COVID-19. And the more we are able to reduce the spread now by our own actions, the more effective we're going to have, or the more effectiveness we're going to have out of this new tool that's just about to be unleashed on all of us and to help us in our fight against COVID-19. So I think that the more we can just hold fast, stay strong, recognize that it does work, because it is evidence proven. We know that distance works. We know that vaccine will add some extra punch to our fight. And if we can just hang on a little bit longer, we will soon get back to the kinds of lives we'd like to have and get back to life as we knew it.
As they say, from your lips to God's ears, and I'm not sure how much of a Christmas break either one of you two are going to get. I hope you get a little one, and at least a little one. And we always are grateful that you take our calls and come onto TVO and share your information with us. So appreciate it very much. Eileen De Villa and Lawrence Loh, the medical officers of health for the City of Toronto and Peel Region, respectively. Thanks so much, you two.
Thanks, Steve.
Thanks.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.